First at 4, new at 4, I should say. This month, healthcare providers, advocates, and members of the community are raising awareness about prostate cancer and making sure that you get screened. This is a big community conversation. And here to share more about what you need to know about the disease and treatment from the Idaho Urologic Institute, Dr. Hassan Dani. Thank you so much for being here with us. I know that this is a topic that some people are uncomfortable to talk about, but it is a very important thing to really talk about when we talk about prostate cancer. What are the misconceptions out there that you think people should probably know?
Yeah, thanks, Joe. So I think what's underappreciated is just how common prostate cancer is. About 1 in 8 to 1 in 9 guys or men are diagnosed with prostate cancer over their lifetime. And it's the most common cancer in men besides skin cancer. About 300,000 men in the U.S. are diagnosed each year. For most men, it's very treatable, but it can be lethal, and it's the second leading cause of cancer death in men in the United States, and about 35,000 men per year die of the disease.
Just getting tested seems like a great way just to make sure, because I know there are some folks that they may have some type of symptoms, but does prostate cancer always kind of show that someone has it?
Yeah, that's a great point. So prostate cancer typically has no symptoms. And that's why it's especially important to get screening, because it only shows symptoms typically when it becomes very advanced and it's spread to other organs in the body. And so that's why screening to get early detection of prostate cancer is very important.
And I know that there's also a conversation about when should you get screened or what age. Is there like a hard deadline or a recommendation at this point?
Yeah, I mean, there's a lot of different organizations that have recommendations, but most of them seem to overlap. So typically men age 50 to 75 should get screening. And screening is something that's very straightforward. I think some men get scared about what that means. It's really as simple as a blood test that's done in the office and an exam with the doctor. For some men, they're at higher risk for prostate cancer. So black men or men with a family history in particular are at higher risk. And those men perhaps should have screening even earlier. Sometimes we start that at age 40 to 45. So it's really sort of an individualized approach.
And can genetics, I guess you kind of touched on it, do genetics and other, I guess, family health factors increase the likelihood of somebody getting prostate cancer?
For sure. Family history is the strongest risk factor. So if you have dad, grandfather, uncles, cousins, anybody that has prostate cancer in the family, something that people don't often realize, breast cancer can also be genetically linked. So a man with a family member with breast cancer may be at increased risk for prostate cancer. So yes, there are many genetic mutations that can predispose somebody to prostate cancer.
And I know medicine and technology continues to evolve. I would imagine that the treatments for prostate cancer these days would look a lot different than years in the past.
Yeah, I mean, I think that's another thing we often hear. Men, they worry about if they're diagnosed with prostate cancer, what does that mean in terms of side effects from treatments? And I think we do a lot better now than we used to do in the past. There's a lot of new technology, both with imaging, MRIs, and PET scans that let us better tailor treatment decisions for patients. And we're getting a lot better at treating cancer also through robotic surgery, advances in radiation. We're bringing a new technology here to Idaho called HIFU, which is high-intensity focused ultrasound, which allows a more targeted approach to treatment with fewer side effects. And I think that's something that will change in the future as well.
And then real quickly, before we wrap up, I understand there's an event, the Blue Ribbon Rally Charity Car Show. What's going on with that? Yeah,
so that's this weekend, this Saturday between 10 a.m. and 2 p.m. It's in Meridian at our office, Idaho Urologic Institute, just off Eagle Road. And this is a charity show to raise awareness for prostate cancer and to raise funds. All the donations go to prostate cancer charities and Idaho 2Fly, which is a big organization that we work with quite a bit. So it's a family-friendly event. It's free to the public, and we encourage you all to come.
Awesome. Okay, Dr. Hassan Dani, thank you so much for joining us here. We have to go for a quick break, but we'll have more details about this at ktvb.com.